All right, welcome back. Moving on to Chapter 5, Ethics. And while oftentimes we use the word morals and ethics to mean the same thing, they're similar, but they have unique meanings. And what we hope to do in this particular chapter is to talk about medical ethics. Boy, that slide does not want to... There we go. So we're going to define ethics, we're going to define morals, we're going to define what is unethical and what medical ethics refers to. We're going to distinguish between ethical and moral decisions that the paramedic may have to make. We're going to identify the premise that should underlie your ethical decision in caring for patients, and discuss some ethical dilemmas that paramedics typically encounter in the field. And we'll analyze the relationship between law, ethics, and EMS. We'll discuss the rights of patients and compare criteria used in allocating scarce EMS resources. We'll identify issues surrounding the use of advanced directives in making pre-hospital resuscitation decisions, and we'll discuss some basic virtues that are most essential in EMS professions. Now, as we've said already in the roles and responsibilities, and as you know, people trust EMS providers. If you look at a multitude of different surveys, the number one trusted profession in the United States is the paramedic. And that trust is something that is earned, and it's earned by your actions. When you carry yourself in a professional manner and you act professionally, you do gain the trust of those that you care for. And gaining trust requires you to adhere to a set of rules and values, and that's certainly what ethics is about. Ethics is the societal principles of conduct. In other words, the society decides what is ethically right and what is ethically wrong. And depending upon where you live in the world, ethics are different, because different societies have different ideas on what is right and what is wrong. Now, morals are values that you hold within yourself that help you define what is right and what is wrong. An unethical behavior would then be conduct not conforming to approved standards of a society, or not conforming to approved professional behaviors. Morals, as we mentioned, were values that you have where you live, based on your standards and your customs. And medical ethics is based on these basic principles. Primum non nocere, which means to do no harm. Beneficence is certainly a principle of medical ethics, and beneficence is to do good to others. And autonomy refers to the patient's right to choose, and justice is making fair decisions about health care. So when we think about medical ethics, first, as a paramedic, we want to do no harm. We do want to do good to others and help others when called upon, and understand that even though we may think that the patient needs to go to the hospital, the patient, if they're competent, has the right to choose where they go, what sort of care they receive, and those sort of things. And then justice again refers to us making fair decisions about a patient's health care, regardless of the condition or type of patient. Ethics is also based off truthfulness and honesty. It's important that patients know the truth about their illness or their injury or the medical treatment that you're going to provide. With that, we shouldn't make false promises. We shouldn't say things that we're not 100% certain of. If I'm looking at a 12-lead ECG and I see elevated ST segments in 2, 3, and AVF, I know that this person is having an inferior injury, a particular type of heart attack. And I could tell them that certainly if they wanted to know what I saw on the monitor. But I couldn't tell them that everything's going to be okay because I don't know that to be true. Medical ethics differ from law. When you breach medical ethics, the punishment is usually more serious when medical ethics are broken. So medical ethics require that as a paramedic, we have a greater responsibility than the average citizen to carry ourselves and uphold to ethics. Again, we're back to that, patients trust paramedics, and we need to respect this trust. And in doing so, if we practice integrity, or what I like to call moral fortitude, doing what's right, what's in the best interest of the patient, even if it's not a popular decision, or even if you're getting a lot of pressure from other your partner or your peers, if it is in the right interest of, in the best interest of the patient, and it's what you believe is what should be done, maintaining that integrity helps maintain that trust. The other thing to keep in mind is that there's no other profession that comes into a patient's home during some of their most embarrassing times in life, as well as some of their most challenging times in life. And the belief or the assumption is that as a paramedic, when you care for this patient, the intimate details about that care are not going to be disclosed. And that's certainly one way in a community to quickly lose the trust of your community, is that if intimate details about particular calls end up being shared in the community. Patients' well-being relies on more than just medical care. You think about a patient's financial status. Healthcare is expensive, and if they have the ability to pay for the care, they'll often call sooner than later. But in many instances, because a patient doesn't have the financial means to call to seek out medical care when they're ill, they often wait until they're seriously ill. Patient well-being also relies on freedom from fear. The fear of personal pertinent information being shared in the community, freedom from fear of the unknown, freedom from fear of the medical care that you're going to provide or the outcome that they may experience. Patient well-being also relies on patient well-being also relies on making them comfortable. We all have certainly different spiritual beliefs and spiritual needs, but patient well-being also relies on a spiritual peace. And remember that as a paramedic, as an EMS professional, you are a patient advocate. You're the eyes and the ears in assuring that this patient receives the best care possible within your scope and your means when you do care for them. Some common dilemmas that paramedics are going to face concerning ethics is making the patient feel that their needs are met. That can really be a challenge, particularly if your patient has a lot of needs. And understand too that the patient's wishes may conflict with your scope of authority. A patient may ask you to do something that certainly isn't within your scope of practice or in your scope of authority, and that'll be a dilemma on how you handle that. Oftentimes the patient's wishes may conflict with the family wishes. So if you're on scene and the family wants the patient to come to the hospital, and the patient does not want to come, you get that conflict between the patient and the family that you'll need to deal with. And the patient's wishes may conflict with your own biases. You show up to treat that patient who's having just textbook crushing substernal chest pain, and you're pretty certain that it's sounding like it's heart related, and the patient is competent, awake, and is refusing care. The patient's wishes to refuse care certainly are going to conflict with your belief that they should go to the hospital and have their heart checked out. Which brings us to the fact that patients have a right to live or die, and as long as they're as long as they're competent, as long as they're alert, awake, and oriented to person, place, and time, and they know what's going on, they have a right to refuse care, even if that refusal would cause them death. And patients may also make medical decisions based, again, on their financial ability to pay. And oftentimes what we see in this instance, again, is that patient who waits till they're critically ill before actually seeking help because of not being able to pay for care. When we look at the Code of Ethics from a historical perspective, ethics has been a guide for interactions between healthcare and professionals and the public in the days before Christ. Hammurabi in Mesopotamia in 1700 BC wrote 282 laws concerning interactions between healthcare professionals and the public. And in those laws were things like an eye for an eye. And the interactions or the type of care provided was graded depending on social status. Certainly a person of wealth received better care than that of a slave. And Hippocrates in Athens in 400 BC developed the Hippocratic Oath, which outlined the physician's responsibility to patients, and in fact is an oath that physicians take yet today. And Paracelsus in Rome, 2 AD, was one of the first historian of medical practices. He was an encyclopedist who began recording all the current medical practices at that time. Some modern code of ethics, certainly that we abide by, include the EMT Code of Ethics, which was adopted by the National Association of EMTs in 1978, and was recently revised in, I believe it was 2004. There was a Nurses Code of Ethics, which was published in 1953 and revised in 2005. And then the American Medical Association has a Code of Ethics written in 1855, and it's based on 9 principles of to do no harm and identifying the type of care that physicians should provide. There's also a Code of Ethics for EMS practitioners, and I'd mentioned 2004, but what happened was the National Association of EMTs took the EMT Code of Ethics, written in 1978, and revised it and renamed it the Code of Ethics for EMS practitioners, because an EMT Code of Ethics might reference the EMT and not include the emergency medical responder or the advanced EMT or the paramedic. So in 2003, NAMT revised that EMT oath and called it the Code of Ethics for EMS practitioners. A Code of Ethics for EMS physicians, the American College of Emergency Physicians in 2006 wrote that Code of Ethics, and it identified how physicians should deal with patients in crises. Now, some responsibilities of EMS professionals, as we had mentioned earlier, and one and foremost is primum non nocere, which is Latin for first do no harm, and it exemplifies the primary responsibility of a paramedic to help people when called upon. Now there's going to be times where a paramedic may sometimes question or challenge a physician order. The legal decision may be unethical, or an ethical decision may be illegal. If you're on scene and a physician gives you an order for something that is outside your scope, then that is that's a legal decision that may be unethical when you practice outside your scope. The Patient Bill of Rights was created in 1997, and it's an information disclosure that says that patients have a choice of provider, they have a choice of plan, a patient has a right to access emergency services, a patient has a right to participate in their treatment decisions, a patient has the right to respect and be non-discriminated against. A patient has a right for their healthcare information to remain confidential, and they have a right to file complaints in some sort of appeal process. Professional accountability. We know that as an EMS profession, we work closely with fire and law enforcement and emergency departments and physicians, and certainly those organizations and those peers. Conflict can exist between what we believe is in the best interest of care and what they believe is in the best interest of care. Students, when they're precepting, particularly if they can't perform a particular skill, there may be a conflict there. And an EMS provider, paramedic, needs to be familiar with the laws in their state. And as we had mentioned earlier, there will come times in your dealing with patients where you're going to struggle with some moral conflicts. What you believe to be right and wrong may be entirely different than what the patient believes is right or wrong. As an EMS professional, you have the accountability to stay certified, and that requires us to complete our continuing education. It's important that you take that role of the lifelong learner, and we never stop learning. We're continually reading. We're continually updating what it is that we know, because inevitably, new techniques come out, new medications come out, and if we don't keep up with that, we can fall behind in the standards of care. We also should look and act the part. We have that accountability to look and act the part of a healthcare professional. Some basic virtues certainly in a EMS professional include courage or integrity, standing for what is right, honor and telling the truth, humility, being humble, kindness, being caring and considerate of all patients regardless of the situation, and respecting patients is key to good patient care. They can sense that. If you don't respect them, if you're not kind, certainly they pick up on that quickly, and that can lead to some conflicts concerning care. The best test of ethics, I believe, is that can you say to your patient, "I did my very best for you"? If your family member was the patient, would you have treated them any differently? And was the care that you provided in the best interest of the patient at that moment in time? Because as the call unfolds and we gather more information, we have to change our care sometimes. But ask yourself, did I do my very best? If it were my family member, would I have done anything different? And is the care that I provided in the best interest of the patient at that moment in time with the information that I had? So in summary, ethics are a societal principle of conduct. In other words, the society decides how people should act. Morals are more values that you have that help you define what's right and what's wrong. And morals are derived from teaching. They're derived from your parents, your grandparents, your mentors, your religious and spiritual beliefs. Unethical conduct is conduct that does not conform to an approved standard of social or professional behavior. And unethical conduct certainly carries, stricter penalties, and because we are in medicine, EMS providers are held at a higher standard when it comes to ethical conduct. Keeping the intimate information that you discover while caring for patients private is important in maintaining trust with your patient population. And remember that honesty and respect for humanity are important essential traits of being a paramedic. The Medical Code of Ethics throughout history and modern times focuses first on doing no harm and identifies other responsibilities of healthcare professionals. Remember that patients have a right based on autonomy and dignity, and we need to uphold those rights, and that professional accountability includes staying current, staying certified, maintaining good relationships with yourself and your colleagues by always placing what's best for the patient first, and remember that these basic virtues exemplify the basis of ethical behavior, and you can tell when a paramedic is ethical based on their relationships with certainly their peers and their patients. That ends this particular talk on ethics. If you have any questions, you certainly can reach me at the web address jmesserol@spencerhospital.org, or you can post questions on the bulletin board on the Iowa Western Community College paramedic website. Talk to you soon. Bye.